Greetings and welcome to this presentation on endocrine agents by Nicole Treb, Leah Zwilling, Sarah Tasto, and Sherry Steffes. In this presentation, we will discuss a summary of the endocrine agents and the endocrine system, give 3 drug examples, discuss typical routes of administration, common side effects and adverse effects, special considerations, and common nursing interventions. The endocrine system is composed of glands that secrete hormones into the bloodstream. Hormones are either proteins or steroids. The endocrine glands include the hypothalamus, pituitary gland, thyroid and parathyroid glands, adrenal glands, pancreas, ovaries, and testes or gonads. Steroid hormones are found in the adrenal glands and the gonads, such as the ovary and the testes. The other hormones are protein-based. The pituitary gland has a posterior and anterior portion, each with different functions. The anterior portion is considered the master hormone because it secretes hormones that stimulate other endocrine glands. The posterior gland secretes 2 neurohormones, and those are vasopressin and oxytocin. The anterior lobe secretes growth hormone, and that stimulates the bone and tissues, thyroid stimulating hormone, which acts on the thyroid gland, adrenocorticotropic hormone, which stimulates the adrenal gland, and gonadotropins, such as follicle stimulating hormone and luteinizing hormone, which affect the ovaries. The thyroid secretes 2 hormones, is divided into 2 lobes, and is located anterior to the trachea. The hormones T4 and T3 are responsible for metabolic rate and activity of almost every tissue and organ throughout the body. Stimulation of the thyroid hormones increases cardiac output, oxygen consumption, protein synthesis, carbohydrate use, and lipid breakdown. Conditions typically seen with an increase or decrease in thyroid hormones are hyperthyroidism and hypothyroidism, respectively. You can see in this little diagram on the bottom left here, basically when thyroid hormones are secreted by the hypothalamus, it stimulates secretion of the thyroid stimulating hormone by the pituitary gland, which in result stimulates secretions by the thyroid gland. You can have too much, and there's several signs and symptoms if you do not have enough. Parathyroid glands lay on the dorsal side of the thyroid and are paired inferiorly and superiorly. The glands secrete parathyroid hormone, regulating the calcium levels in the blood. So if the serum levels decrease, then this hormone is stimulated, which increases calcium from the blood, absorption of calcium from the intestines, or reabsorption of calcium from the renal tubules. The adrenal glands are located at the superior surface of the kidney and have 2 sections. The adrenal medulla releases epinephrine and norepinephrine associated with the sympathetic nervous system, and the adrenal cortex produces glucocorticoids, which basically influence your electrolytes and carbohydrate metabolism. It also secretes mineralocorticoids. The pancreas is really unique in that it has both endocrine and exocrine properties. So endocrine secretions work to break down glycogen into glucose, and the exocrine section secretes digestive enzymes into the duodenum. Let's give some examples. The first example that we have for you today is levothyroxine. This is known by the trade name Synthroid. Most commonly, you will be seeing this given to adults in an oral tablet formulation for hypothyroidism. The dosing would be 50 micrograms in a single dose. Then every 2 to 3 weeks, you're going to be increasing that dose by 25 micrograms per day. Typically, once you hit that maintenance level, that dosing is going to be 75 to 125 micrograms per day, or 1.5 micrograms per kilogram per day. If you're treating children, geriatrics, or infants, you're going to need to make adjustments in those dosages. It can also be given intramuscularly and intravenously for adults and children, and again, those dosing adjustments will need to be made accordingly. Side effects. Typically, you're only going to see side effects if you have excessive doses causing basically a hyperthyroidism. Those side effects are going to include headache, insomnia, irritability, angina pectoris, arrhythmias, tachycardia, abdominal cramps, diarrhea, vomiting, sweating, hyperthyroidism, menstrual irregularities, heat intolerance, weight loss, and in children you're going to have accelerated bone maturation. Adverse effects were not identified by the Davis Drug Guide. Special considerations. Geriatric populations are going to be extremely sensitive, so that initial dosing should be low. Make sure to administer with water on an empty stomach 30 to 60 minutes before breakfast in order to avoid insomnia. Take this medication 4 hours apart from antacids, specifically iron and calcium, including supplements as well. And oral and insulin hypoglycemic doses might need to be increased in diabetics while they're on this medication. Common nursing interventions. It's important to assess the apical pulse and blood pressure, assess for tachyarrhythmia and chest pain, and monitor for overdose, which again is going to be manifested as hyperthyroidism. And the symptoms of hyperthyroidism are going to be tachycardia, chest pain, nervousness, insomnia, diaphoresis, tremors, and weight loss. In children, you'll want to make sure to monitor their height, weight, and psychomotor development. Our second example is a drug called prednisone. Prednisone can be given orally to adults. For most reasons for it being given, the dosing is going to be 5 to 60 milligrams per day as a single dose or possibly divided. It can be given orally to children. Depending on what you're treating, the dose is going to vary. So for nephrotic syndrome, the dose is 2 milligrams per kilogram per day with a maximum of 80 milligrams per day. And you're going to continue that dose until the urine is free or clear of protein. Then you're going to hold a maintenance dose, and after 4 to 6 weeks, that dose will be tapered down. It can also be used orally for children for asthma. And when you're treating asthma, the dose is going to be 1 milligram per kilogram every 6 hours for 48 hours, and then 1 to 2 milligrams per kilogram per day with a maximum of 60 milligrams per day, and that dose would be divided into a twice daily dose. There are potential side effects with prednisone, and those include depression, euphoria, headache, increased intracranial pressure, mainly in children, personality changes, psychoses, restlessness, cataracts, increased intraocular pressure, hypertension, anorexia, nausea, vomiting, acne, decreased wound healing, ecchymoses, fragility, hirsutism, petechiae, adrenal suppression, hyperglycemia, fluid retention, mainly if you're on a long-term high dose, hypokalemia, hypokalemic alkalosis, thrombophlebitis, weight gain, muscle wasting, osteoporosis, avascular necrosis of the joints, muscle pain, increased susceptibility to infection, and a Cushingoid appearance. And I have a picture here that you can see of the Cushingoid appearance, which typically manifests as a moon face, kind of that swollen moon face, and they often have what's called a buffalo hump on their upper neck, which you can't see in the picture, but at least you can kind of see what that moon face looks like. Adverse effects include peptic ulceration and thromboembolism. Special considerations. If the dose is administered every day or every other day, it's important to give this medication in the morning to coincide with the body's natural secretion of cortisol. And supplemental systemic corticosteroids may need to be given during periods of stress, such as surgery and things like that. It's also important to administer this medication with meals to minimize any gastrointestinal upset. Common nursing interventions. Assess for signs of adrenal insufficiency, and those signs are going to be hypotension, weight loss, weakness, nausea, vomiting, anorexia, lethargy, confusion, and restlessness. Make sure to monitor input and output every day and daily weights. Monitor serum electrolytes and glucose. And those that are on this therapy for a prolonged period of time are going to need routine CBCs, serum electrolytes, and serum urine glucose evaluated as well. Our third example is calcitriol. This medication is often given when clients are receiving dialysis or prior to dialysis. So in the bottom corner here you can see a gentleman in the process of dialysis treatment. So orally it can be given to adults for hypocalcemia during dialysis, and the dosing for that would be 0.25 micrograms per day or every other day. This can be increased by 0.25 micrograms per day at 4 to 6 week intervals, and the typical dosage that you're going to see is 0.5 to 1 micrograms per day. For hypoparathyroidism, the dose is 0.25 micrograms per day initially, then increasing that dose by 0.25 micrograms per day at 2 to 4 week intervals until you reach that typical dosing of 0.5 to 2 micrograms per day. In the pre-dialysis type of treatment, the dose will be 0.25 micrograms per day up to 0.5 micrograms per day. This medication can be given to children orally. It can also be given intravenously to adults and children, but there's going to be dosing requirements required for both of those applications. Side effects. If you're going to see side effects from this medication, it's going to be usually manifested as a toxicity or hypercalcemia, meaning too much calcium. Those side effects are going to be headache, somnolence, weakness, dizziness, malaise, conjunctivitis, photophobia, rhinorrhea, dyspnea, abdominal pain, anorexia, constipation, dry mouth, increased liver enzymes, metallic taste, nausea, polydipsia, vomiting, weight loss, albuminuria, azotemia, decreased libido, nocturia, polyuria, pruritus, hypercalcemia, hyperthermia, bone pain, muscle pain, arthralgia, metastatic calcification, pain at the injection site, allergic reactions, chills, and fever. Adverse effects are going to include pancreatitis. Special considerations. Make sure to stay protected from light, avoid concurrent use of antacids containing magnesium, and also note that calcitriol may cause false high cholesterol levels, so be aware of that if you do get some of those readings back abnormally high. Common nursing interventions: assess for bone pain and weakness, monitor for hypocalcemia, and some of those signs would be paresthesia, muscle twitching, laryngospasm, colic, cardiac arrhythmias, Chvostek's or Trousseau's sign. And you can see in the diagram here basically what those would look like. The facial nerve stimulation test, or kind of that mannerism with the hand. It's also important to assess serum calcium and phosphate concentrations twice a week initially. And then monthly you would want to monitor serum calcium, magnesium, alkaline phosphatase, and intact PTH. So let's summarize. This presentation has included a summary of the endocrine agents, drug examples, typical routes of administration, common side effects and adverse effects, special considerations, and common nursing interventions. Thank you for watching this presentation by Team All the Azepams.